I'm Dr. Christoph Correll, and today I'll be talking about what is the efficacy and safety of muscarinic receptor modulators in patients with schizophrenia. Muscarinic modulators are a new class of antipsychotics. Since September 26, 2024, we have the first member of that class approved by the FDA for the treatment of schizophrenia, and that is xanomeline trospium, a combination of an M1/M4 agonist xanomeline with a peripherally restricted anticholinergic trospium to buffer the side effects peripherally of xanomeline. The first study was a phase 2b study where xanomeline trospium beat placebo in a 5-week study, having an effect size published of 0.75 but recalculated of 0.81. Let's put that into context. Across all antipsychotics, in a meta-analysis by Hoon et al. In 2019 in Lancet, the overall effect size across all antipsychotics was 0.42, and for risperidone 0.55, for olanzapine 0.56. So this is a very strong effect size. The study was conducted for 5 weeks. There was a 1-week titration phase with 50 milligrams xanomeline and 20 milligrams trospium for 2 days, then another 5 days of 100 milligrams xanomeline and 20 milligrams trospium. And then as of day 8, the highest approved dose of 125 milligrams of xanomeline plus 30 milligrams of trospium. There was good efficacy for total PANSS, where I just mentioned what the effect size was, but also positive symptoms improved, negative symptoms improved significantly, and the CGI, the Clinical Global Impression Severity Scale. However, there were also side effects, both procholinergic, nausea in about 17%, vomiting in about 9%, but also anticholinergic side effects like dry mouth, 9%, constipation, 17%, and dyspepsia, also 9%. However, when looking at the side effects more closely, they seem to emerge in the first 1 or 2 weeks, and then the peripheral effects attenuated. By week 3, almost all of them were done and gone, and the side effects were only mild to moderate. That's interesting that because of that trajectory of the side effects and their being only mild to moderate, there was also a very low discontinuation for adverse effects. It was only in that study 2% in the trospium xanomeline combination versus 2% on placebo. After the phase 2b study, there were 2 phase 3 studies that totally replicated the results in terms of good effect for total PANSS with an effect size of 0.61 and 0.60, which is very well understood that in larger studies the effect size drops a little bit, but pooling that together for total PANSS, the effect size is 0.65, which is still quite respectable. Remember, 0.2 is a small effect size, 0.5 medium, 0.8 is large. There were also similar effects on positive symptoms, and in one of the 2 studies also significant for negative symptoms. In terms of pooled side effects then, there were side effects, but again a very small contribution to discontinuation for adverse effects. 5.6% pooled across the 3 studies on xanomeline trospium and 4.7% on placebo. In terms of side effects per se, there was 18.5% nausea and 13.5% vomiting. 30% of patients had vomiting only once, and those are the procholinergic side effects. And then of the anticholinergic side effects, there was 17% constipation, 15% dyspepsia, and also 5% dry mouth. But again, these side effects were mostly very tolerable, at least in the context of a randomized controlled trial that was an inpatient study where nursing staff was around people. And the question is, how will that translate into the real world now that we have this medication approved by the FDA? In addition to the effect on psychosis in the acutely exacerbated patients across these 3 studies, there was also a measurement of cognition, since the M1, M4 stimulation can lead to antipsychotic effects, but the M1 stimulation, particularly in the frontal lobe, can also improve cognition. What was found there was that across the 3 studies, when you took all patients that were in the acutely exacerbated studies, or studies of acutely exacerbated patients with schizophrenia, there was a non-significant effect on cognition. However, when the 50% of patients were analyzed that had at least one standard deviation below the general population norm and had more relevant cognitive impairment, the effect on cognition was statistically significant and clinically meaningful, with effect sizes of about 0.5. And although this was an acute study, there was no clinically determinable effect that it only would improve the cognition in patients that also had strong improvement in positive or total symptoms. However, to verify that, studies are needed that would look at patients who have stabilized positive symptoms. Following on the heels of this M1, M4 agonist, xanomeline trospium, approved by the FDA, there's also an M4 positive allosteric modulator called emraclidine, which in a phase 1b study, very small, 27 patients only in each group, also showed statistically significant effects and effect sizes that were very meaningful by the end of week 6. And that was for the 20 milligrams twice a day of 0.59 effect size, and the 30 milligrams once a day, which is carried forward right now in phase 2 studies with an effect size of 0.68. So again, a very respectable effect size. The effect was significantly better than placebo for the total symptoms, but also PANSS positive and PANSS negative symptoms, as well as the Clinical Global Impression Severity Scale. Side effects here were very limited because this is a very specific M4 modulating medication, emraclidine, and therefore no anticholinergic peripherally is needed, and there's also no spillover into the periphery, or very limited. The only side effect that had double digits and was different from placebo was dry mouth of 11%. There was also a double-digit side effect of headache of 26 and 30%, but it was also present in 26% of patients with placebo. This is a once-a-day dosed medication, and we don't have a titration needed, whereas xanomeline trospium is twice-a-day dosing and has the titration needed that I mentioned initially. Thank you for your attention, and I hope that this was helpful information to you.